and welcome to the state of abortion access in Michigan. I'm so happy that you're here, and I really appreciate that you are joining us on your Monday evening and been making time for us to join in the conversation. I know that there's some people still coming in. I expect that to be the case, but we have so much to cover. I thought that we would just get started as quickly as possible. Just a little bit of background about who I am. My name is Jex. I use they, them pronouns, and I'm a founding member of Hydra Fund. And I'm coming in from Detroit, Michigan, where I live. I'm also the organizing director at Shout Your Abortion, so I get to think a lot about abortion every day. And I'm an abortion doula, so I help people get abortions throughout the country. I also want to do a shout out to Tam, who's here, and they're doing tech support today. So if you need any support, help, have questions, you can message Tam or just drop something in the chat and they will support in whatever way they can. I also just want to welcome you to share where you're joining from and maybe what brought you to this session in the chat as well. We will be using it throughout the presentation, so I'm not just chatting at you constantly for the next hour and a half. I would love for this to be more interactive. I'm going to go into our first little section here, which is just a little bit of background about who Hydra Fund is. So Hydra Fund is an independent nonprofit mutual aid fund. So we're a fiscally sponsored project of IPASS, and we support abortion access and reproductive care in Michigan. We firmly believe that all people deserve to make choices and have agency and access to resources to make decisions about their reproductive futures. And our mission is to eliminate barriers to abortion access. And we want to do that by providing direct financial aid for purchasing abortion pills or supporting people through clinical care costs. We also are supporting people navigating a complex medical and practical landscape, and also providing live doula support through someone's abortion at home. So we have a doula training program to help be there for people when they need it most. In addition, we're not just about giving people money and tools. We also really want to be engaged in an education program and community outreach program so that we can support our neighbors in ensuring they have access to evidence-based abortion information, because we believe that all of us have a huge role in ensuring access and expanding access, and we don't want to gatekeep any of that at all. We want you, everybody who's here, to be part of that process. So thank you so much for being here and being part of that, being part of helping people have access. So that's all I'm actually going to say today about Hydra Fund, or that's basically all, but I wanted to just mention that in 2 weeks, we're going to have a webinar that's a little shorter than this one, just an hour long. That's going to go much more into detail about what we do and how we work, ways you can get involved, or if you just want to know what kind of services we provide so you can let other people know who might need it. And Tam's going to drop the registration link in here. And it's just like this, anyone can attend, but we just ask that folks register in part to keep things safe for everybody. On that note too, Tam is going to be, again, monitoring the chat and monitoring videos just to make sure that everybody's safe. But like, feel free to tag them in if you see something weird going on. Okay. I just wanted to mention here why we're here, why we're doing this. So this session is really about understanding what abortion actually is like on the ground. And most importantly, how we can help expand it. So abortion is protected in Michigan, but as some of us may know, and what we're going to learn today, is that protection does not equal accessibility. So there are barriers like cost, distance, stigma, confusing laws, insurance coverage, and structural racism that all play a role in limiting care, even when the law says it's allowed. And so today we're going to be unpacking that gap between what's legal and what's possible. And we are really approaching this from the perspective of people who have had abortions. So I'm a person who's had an abortion more than once in the States, and support people, and from the perspective of people who support others in getting abortions throughout the state every single day. So this is not a theoretical conversation. It's really rooted in the lived realities of people that we meet every day and lived realities of how abortion access actually functions. So here's what we're going to cover today. And I have some time durations here. I'm hoping that we stick to them. I'm going to do my very best. But we're going to go over how abortion actually works, so just the basics of care. Then we're going to go into the laws in Michigan, and what they cover and what they don't. And then the real life barriers people face when seeking care here, stories from different lived perspectives, the role of stigma and how it shapes access, and then what is being done and what you can do. We're also going to then have an open Q&A. So as questions arrive in your mind, feel free to drop them in the chat and we can come back to them or save them and add them to the chat at the end. By the end of today's session, we hope that you will leave with a deeper understanding of how abortion access works in real life and what's still standing in the way and how you can be part of building something better. A quick note of how we're going to engage in this chat. Let me see. Yes, a little bit of housekeeping. So consider keeping your camera on if you feel comfortable with that. By no means is that necessary, but it is a little bit nicer to feel like we're talking to each other, feel more connected in ways that can make it a little bit easier to engage. But we also understand that everyone has different needs and are in different environments. So do whatever feels best for you. And we will, again, use the chat throughout the session. So for optional prompts, and participation is encouraged, but not required by any stretch. So please engage in whatever way is most comfortable to you. Even if you're able to think on your own and kind of reflect and don't feel like sharing, I think that that's totally fine. And then we ask that everybody engage respectfully. Disruptive or harmful behavior will not be tolerated. So if we do see that, we will ask people to leave. This is not a space for debate. And then just a little note on content that this presentation does include real-world scenarios relating to abortion access, including systemic barriers and some stigmatizing experiences. So some content may be emotionally difficult. So please just take care of yourself and do what you need to do to be comfortable throughout this session. Okay. And just a reminder too, again, if you are able to share where you're joining from and what brought you to this session, that would be amazing. Get to know who's in the room, where folks are coming from. Also, a quick note that we are recording this. We may or may not be sharing with it later, but we are trying to find different ways of making these kinds of information sessions accessible to more people. So we're going to get started. The first section here is on the basics of abortion. It's really important that we get into the basics. And I know that one thing that we can't, if we're going to talk about abortion, we're inevitably going to also have to talk about a little bit about pregnancy. So I just want to state here who can get pregnant. So anyone who has a uterus and ovaries could become pregnant and give birth. The age range of people who are able to give birth generally range between 12 and 51, although of course there are people on both sides of the spectrum that go beyond or below that. And gender does not determine who can become pregnant. The reproductive anatomy does. So we know that people of all genders, including trans men, non-binary people, and intersex people may need abortion care if they possess a uterus and ovaries. We also want to start here in the kind of the most basic position of, or the most basic starting point where we meet most people, which is I'm pregnant, now what? Part of our role at Hydra Fund is never to encourage people into in a particular direction. We are here to listen and support people through whatever they need and they want. So as some of you are probably aware, if you're pregnant, you have an option to either parent, choose adoption or abortion. And the truth is that nobody can make informed decisions about their body without fact-based information. So our goal here is to make sure that everybody knows all of their options and feel very comfortable in making the decisions that are right for them. And then they have the support to carry out those decisions. At the end of this session, I'm going to email everybody a lot of the links that are going to come up. So feel free to take notes if you'd like, but otherwise we'll be able to send you the slide with all these links. But I just wanted to shout out all options or pregnancy options. So these are confidential spaces to talk about making decisions about a pregnancy. And it's some judgment-free support at any point in someone's pregnancy experience, no matter how you feel about it. So there's one basic starting point for somebody, for yourself, if you find out that you're pregnant and you're not sure what you want to do. So after you find out, okay, yes, I'm pregnant, you're going to want to ask yourself, how pregnant am I? And this is really important for a couple of reasons, but one is that it really shows you what your options are, depending on which way you'd like to go. So the way that a pregnancy is determined is the first day of your last period plus 40 weeks, that equals your due date. And this is called the gestational age, which is the common term used during pregnancy to describe how far along a pregnancy is. There's an online resource here at the bottom that is a pregnancy calculator. But this really helps you know what options are available to you within the system, or how to prepare if you're going to go out, like use a method outside of the system. And we'll get more into why gestational age will come up again in the future. So let's talk about the kinds of abortion. So medical abortion involves an abortion with pills. And it involves taking one or two types of medication. So typically mifepristone followed by misoprostol, which is an FDA-approved regimen in the United States, or in some cases, misoprostol alone, which is also widely and safely used around the world. The first pill blocks the hormone progesterone, and the second causes cramping and bleeding to empty the uterus. It is often used and approved by the FDA from up to 10 to 11 weeks of pregnancy in the United States, but it is used over 12 weeks commonly in the global context. And if you have a question about why that is, I'm happy to answer, and feel free to drop it in the chat. Um, uh, but the places that you get abortion pills is in a clinic, through telehealth, so a doctor online prescribing it to you, or from a source online mailed to your home. So it's the most accessible form of medication, or the most accessible form of abortion. It's also the most affordable and most commonly used. Procedural is also the second kind, the major kind of abortion that you can get. It's also sometimes called a clinical or surgical. A clinical procedure, it involves a clinical procedure that uses suction and or surgical instruments to empty the uterus. And despite the name surgical, it doesn't actually involve incisions. And general anesthesia is not required in most cases, but it may be used depending on the provider, the clinic, or patient needs. It is available throughout pregnancy, typically up to the point of legal viability, depending on state law and individual clinical policies. So both of these methods can be used throughout pregnancy, and you can start to see already the kind of limitations to access and use of them are determined by the state laws or by the clinic policies. Of the procedural, there are two different types. Most commonly, aspiration abortion is one of the most common methods. It's used usually after the 11 or 12-week mark, or when medication abortion is not preferred. So a lot of people come in, they don't want a medication abortion, they would choose this method. It involves inserting a thin tube through the cervix into the uterus and then using this very gentle suction to remove the pregnancy tissue. It is a quick outpatient procedure. It usually takes about 5 to 10 minutes. A D&E, or dilation evacuation, is used after 16 weeks, and it involves dilating the cervix and removing the pregnancy tissue with also suction instruments. It involves a little bit more medical, it involves a little bit more involved with the medical supplies used, and of course the dilation, which is typically not needed in the aspiration abortion. And sometimes it takes place in one visit, but sometimes it also requires two, depending on the gestational age. So here we see why gestation is important. So sometimes it takes a while to dilate the cervix, and that's why it can take 2 visits. Another thing to just note that I haven't put D&C in here, which some people have heard of, but it's a lot less commonly used nowadays. And it is sometimes used when the abortion is as a complication or has been is less complete, which is very rare. It involves kind of like the scooping out of the contents. And so it's a little bit different, but it's not very common at all. So it's not on this list. Abortion is extremely safe. Uh, it is has a lower risk of serious complications than many common medical procedures, including childbirth and wisdom tooth removal. It has a less than 1% risk of serious complications across all methods. And it is about 97 to 99% effective in ending a pregnancy when used up to 10 to 11 weeks. And I think that studies are showing that it's similarly effective even beyond that point, although we have less information. The risk of death from medication abortion is less than 1 in 100,000, which is safer than Tylenol, penicillin, and childbirth. And I say all of this because it's really important to know what options are available and why they are good options. And especially because to come informed and to be a source of information in your community or amongst your friends and family, it's important to smash stigma and to challenge misinformation. So where do people get abortions? Uh, so we can get abortions. We can get both medication and procedural abortions in clinic. But that really depends on the location. And as we'll talk about later when we get to where the clinics are in Michigan, many clinics only provide medication and they don't do any procedural abortions. And this has an impact on who can get care. For example, if you're beyond 12 weeks or you've had medication, you really disliked the way it made you feel, that would limit how many options you have in terms of clinical care. Clinics can offer in-person evaluation, ultrasound, and some follow-up care. And they may be part of large organizations like Planned Parenthood or an independent clinic, which make up actually the most of the abortion providers in the United States. You can also get medication through telehealth. So that allows people to access medication through the mail after an online consultation or brief screening by a licensed medical professional, typically a physician, nurse practitioner, advanced practice clinician. And the medicine is then mailed to your home after filling out a form. And then very similarly, online pharmacies offer medication through the mail as well. And it doesn't require this kind of intake form procedure. And you don't typically talk to a doctor, and it is mailed to you quite quickly. So just talking about a little bit of the pros and cons. So clinics offer a range of services, and I say potential again because some of them do not offer procedural, but many do offer both. They offer in-person support if you're doing procedural and follow-up care. Although I will note that if you do get medication from a clinic, they still give you the medicine to take home at home. So you're going to get that medicine that you could have received in the mail and then taken it in your living room or your bedroom or whatever. So it's a very similar experience. You also have access to labs and ultrasound and sedation if that's something that you chose to do. The cons there are that you may be required to travel a significant distance to get to the nearest clinic. It can involve long waits to get an appointment, or you might have to experience protesters outside, and there are significantly higher costs associated with going to a clinic. For telehealth, it is safe, it is private and done at home. It is a much lower cost, and it requires no travel, and it's very quick. Typically takes 1 week to arrive. Similarly, with online pharmacies, is often a low cost or free, available when clinics or telehealth are inaccessible, and they can be more discreet or autonomous. But then the cons here are similar for telehealth and online pharmacy. So you may have trouble obtaining medication if you're over 12 weeks. It requires internet and a mailing address and some tech literacy. So if you don't have a place where you can safely receive mail or use the internet, that is a barrier to access. You usually need to find an alternative resource for questions or support during the process, and we'll go over what some of those are. But for example, HydroFund has a helpline that someone could call if they have questions. And there's a few other resources like the miscarriage and abortion hotline where you can chat online or text or call and talk to somebody, but you're not going to be able to call up the clinic typically or the provider online. It also requires a safe place to take the medicine. So again, if you were getting medication from a clinic, you would still need to find a safe place. But I just want to note that not everybody has a safe place to take medication. Maybe they're living with a partner who doesn't know or want them to have an abortion. Maybe they're living with parents, or maybe they have a lot of kids at home. And the idea of having to go to the bathroom a lot to go through the abortion is just not practical or probable. So I'm just curious, if we can engage in the chat a little bit, but are you able to name the abortion clinic that's nearest to you and how late into pregnancy they can provide care? And I'll leave it open for just a minute to see if you can, and feel free to either leave the answer in the chat or just write yes or no, or I'm not sure. So we can kind of gauge where you are. The reason why this prompt is here is because we want to make sure that if you run into somebody, if a friend, family member, someone you come across that's like, I am pregnant, I'm not sure what to do. I think I'm going to go get clinical care. I need to know where the clinic is. It's really great if you can just have an answer to support them. At the very minimum, be able to say, I know what resource we can check to make sure we know. But just having a general awareness of what resources exist in your community is an incredible first step in expanding care. Yeah, and Morgan here says that they are aware that their nearest clinic is a Planned Parenthood, but don't remember the gestational limits. That's understandable, of course. And we'll get into a resource that will share it. And I also want to note that some of the clinics, again, only provide medication, and that's really important to know as well. Okay, I'm going to move on, but feel free to keep adding into the chat. Okay, let's talk about what's legal in Michigan and what's not. Sorry, I'm just moving the chat box so I can read. Okay, so the basics here is that abortion is legal in Michigan, including both medication and procedural care up to the point of fetal viability. So viability is typically considered when a fetus can survive outside of the pregnant person's body. After viability, abortion still remains legal when necessary to protect the patient's life or health as determined by a healthcare provider. So as you can see, there's a little bit of ambiguity here that lands really on a healthcare provider's shoulders, which is really hard, and we're seeing that play out in other states. This legality is anchored in the state constitution due to Proposal 3 that passed a couple years ago. Prop 3 nullified Michigan's 1931 near total abortion ban, and it blocks state punishment of individuals for abortion or assisting with one. The thing is that it didn't automatically remove other regulations or trap laws like parental consent, informed consent laws, clinic health standards, or the 24-hour waiting period. However, the great news is that we've recently had some legal wins, and we've removed the 24-hour waiting period and informed consent laws. So 24-hour waiting period required people to come and either come in person and sign a form or print it off online at least 24 hours before their appointments. And it included information like, I understand the risks of having an abortion. I understand that an abortion ends the life of a potential human being. So some very heavy language, state written language that's not written by a doctor. And it required people to do this 24 hours in advance. And the problem with that is that it required people sometimes to travel multiple days more than they would have needed to. If they forgot to print it off, which, like, who has a printer these days, they would come to their clinical appointment and then they would get turned away. And the kind of informed consent procedure was extremely stigmatizing and terrible. So that's overturned, which is an amazing new development. But we do still have some other barriers. So we have a parental consent laws still in the books here, which means that minors under 18 need parental permission or must navigate a judicial bypass process. And we're going to go over what that means in a moment. And And there's also no Medicaid coverage. So state Medicaid would only cover abortion in very, very limited cases in which the life of the patient would be endangered. So we can basically say that it doesn't cover for the majority of people. So again, getting into parental consent, if you're under 18, you have to get written consent from one parent or legal guardian before getting an abortion. And if you are not able to get that, you have to file a legal petition and appear before a judge and be given permission by the court to get care. This process is known as a judicial bypass or judicial waiver. As you can imagine, this is an insane process that somebody would have to go through. I'm sure that everybody here can imagine scenarios where someone may not be able to get written consent from their parent or guardian. And then being faced with the idea that you have to talk to an attorney or lawyer, appear before a judge, make your case that you should be allowed to get an abortion is beyond humiliating and challenging. We also know that young people who can involve a parent already do. And if they can't, this law puts their health and safety at risk. Forced parental consent is absolutely not about protecting young people. It's really about restricting access to abortion. And we know judicial bypass is so difficult to navigate. In addition to just the kind of like pending doom of having to go in front of a court, but there's also notable challenges in navigating courts during things like school hours, seeking transportation, or the financing to get transportation, maintaining confidentiality, and even knowing where they can get legal support. And also fundamentally, judicial bypass delays abortion care. So if you live in a place where you don't have a clinic that provides care that's a little bit further along, you're pushed back week after week after week while you're waiting for the judicial bypass. You may run out of options. You may run out of options in anywhere accessible to you. You may have to go 5 hours away one way, and then that creates an additional barrier for you as a young person. I can't see the chat right now, but I've asked him, okay, maybe I can pull it up, to drop a few. Yeah, so there is a report that came out about the ways in which parental consent abortion law hurts young people in Michigan that I really encourage people to read from the Human Rights Watch. And there's also If, When, How reports, and we'll see if you're able to share that too. Yeah, great. Thank you. And we should keep our eye. I encourage everyone to keep our eye on ways that we can challenge this in the future. Okay, so what kind of things could challenge the protections provided by Proposal 3? So one would be a federal abortion ban. So if Congress were to pass a federal law banning abortion at any stage, it would override state protections. But it would require control of the House, Senate, and presidency by anti-abortion lawmakers. Unfortunately, that seems much more feasible. It seems much more feasible than it has in the past that a ban could happen. People talk about it. I'm not sure it would happen. Turns out abortion is extremely popular amongst conservatives and liberals, but that's not to say that it won't happen. So just something to keep your eye out for, that Prop 3 would not protect us in the federal abortion ban case. An anti-abortion governor or attorney general in Michigan. So a hostile administration could refuse to enforce or actively undermine protection through policy, agency rules, or legal interpretations. They could also appoint anti-abortion state health officials, judges, and medical boards, which would then do lots of interpreting and imposition of potential rules and regulations that would create barriers to providers and to people seeking care. And they could challenge protections in court or reinterpret what viability or health exceptions mean quite narrowly. And we're seeing this in places like Idaho right now. There could also be court challenges or ballot initiatives. So future lawsuits could attempt to narrow the scope of Prop 3, or it could reinstate specific restrictions under the guise of public health or regulation. Additionally, a well-funded opposition group could propose a constitutional amendment, but this would be a long and difficult process. So these are kind of 3 scenarios just to keep your eyes out for, and just to remember that Prop 3 isn't always, these rules are not always airtight. Now we're going to get into practical barriers that undermine legal rights, but I just wanted to make sure that we mentioned that even without legal repeal, access can erode due to clinic closures or staffing shortages, misinformation and stigma, lack of providers trained in later abortion care, funding gaps, so no Medicaid coverage, no money, and growing criminalization of pregnancy outcomes, so suspicion of miscarriages or self-managed abortion, even in Michigan where it is legal, being misinterpreted by the law. So this is the takeaway here is that legal rights are necessary, but they are not sufficient. And while Prop 3 provides strong protections, they can still be undermined by federal bans, hostile state leadership, legal reinterpretations, or just simple barriers on the ground. And protecting access really means defending policy, expanding infrastructure, and showing up in every system that touches reproductive care to help people get the care that they need. Okay, we're going to move on to the systemic and structural barriers now. So talking about barriers, one of the biggest ones is geography. So here's a map of all of the clinics in Michigan. As you can see, there are no clinics in the Upper Peninsula. In fact, no clinics above Traverse City. So 6 of these clinics that are represented only provide medication, and one of those includes Traverse City. So if you want to get a procedural care, you have to travel all the way south to someplace like Flint. 15 of the clinics provide both medication and procedural. 11 clinics provide care after 15 weeks, and only one clinic in the Metro Detroit area provides care up to 24 weeks. If you end up being beyond 24 weeks, you will have to travel out of state for care. And again, there are no clinics north of Flint that provide procedural abortion care. And then I've asked Tam if they'd be willing to share. Maybe they are. Sorry, I can't see everybody's. Yes, great. There we have a spreadsheet and a map here that shows where all the clinics are in Michigan. But as you can see, there's geographically, at least, the majority of the state has access to no clinical care whatsoever. The other major barrier is cost. So there are costs for care. So an average procedural, in going to a clinic, getting a procedural abortion costs anywhere from $600 to over $1,200 just for the care itself. And of course, this isn't covered by any form of insurance typically. It may be covered by private insurance, although even that is extremely rare. If you were to go get medication in clinic, so just given the pills in hand and then told to go home and take them, that costs between $400 to $600. I know for a fact that in Metro Detroit, it's $600 to get the pills. If you want to get pills through telehealth, so talking to a provider or filling out a form online and having a provider that's licensed provide you with pills to your home, it typically ranges from $150 to $300, but I put free on here because a lot of them have sliding scales and they don't require you to prove your income. So most people can get them for free if that's what they want to do. Although I encourage people to pay a minimum of $150 if you're able, so that you can help take care of someone who doesn't have that kind of access. The average medication cost on an online pharmacy is usually, again, free in a similar sliding scale way, or up to $150. And again, the last 3 options here about medication, it is all exactly the same medication. Not a single thing is different about it, but there's a wide range of difference in cost. I also need to talk about practical costs because, again, if you're a person that does need to travel to get clinical care, it's going to cost a lot of money. So, for example, if you have to drive 5 hours for care, like someone maybe that lives in the UP that needs to come down south, let's just say it's a 10-hour round trip. That's going to cost you about $360. Let's say you need to get a hotel. Your appointment, typically appointments start very early in the morning. So let's say they're 8 a.m. So you might need to come down, get a hotel for the night. And your appointment might be all day. And before you can drive all the way back up, you might need another hotel. So let's just say 2 nights. So we're looking at something like $300, which is on the low end. And then let's say you have childcare costs that you have to factor in. We know that 60% of people who seek abortion care are already parents. So certainly childcare is something that needs to be considered. We're just going to say $60 a day. So for 2 days, it's $120. So we're looking for just getting a regular procedural care, something close to $1,380. And this is including getting pills given to you. So this estimate also does not include meals, lost wages, or additional clinic-related expenses. like having to go get some medication for aftercare. Maybe they're going to prescribe you some type of antibiotic or painkiller, that would increase the costs even higher. And these barriers are why logistical and financial support is critical to real abortion access. There's also legal confusion and fear that creates a lot of barriers. So one thing to note is that self-managed abortion is not a crime here in Michigan. So that means obtaining and using abortion pills on your own is not illegal under state law currently. However, many people do not understand this or are simply unaware that abortion pills obtained through the mail is an option for them. Clinics do not counsel people with all options, and this is really important. So if you were to call your local Planned Parenthood, they say, well, you're going to have to drive down to us. It's going to cost $600 to get pills. They will not tell you that you can also go online and get the same medication for free or $150. There's a lot of different reasons why this exists. But one of the reasons is that it actually hurts their business model. They would like you to spend money at their clinic. So this is a really important note because it requires people like us to tell people that they can get medication in other more affordable ways. There are also people who are super scared of how safe medication it is due to misinformation. They may not feel safe getting medication through the mail. They may only feel safe getting it through a clinic or going to a clinic. So it's really important that we share accurate information so that people have all the available options to them. Additionally, legal risks still exist. So even though we live in a non-criminalized state, people have still been investigated or arrested after self-managing an abortion. And hopefully you can find this. Tam, great, I see that you put it in. There's If, When, How report. That's like a group of legal experts that study how abortion access happens in the United States and the legal ramifications. And you can see that Michigan's on the list of having people being investigated after self-managing. Such investigations often misuse unrelated charges. So you might get charged with fetal harm or mandatory reporting rules that penalize people who self-manage. So for example, Michigan has a law that allows someone to be charged with a crime that caused a miscarriage by harming a pregnant person, even if that harm was not intended to end a pregnancy. So this is often used for people who are drug users and pregnant. They can have their babies taken away from them or be charged with harm of a fetus, or partners or other people who have been physically abusive. That's what they kind of started out to be, but it's the way that it leaks over into all different forms of criminalization, even based on who you have encounters with. Maybe somebody at a hospital or at a police station is anti-abortion. They might be anti-abortion. They might have really strong feelings. If they know you've taken medication, they may start to bring charges up against you, even if they may not pan out in the courts. And the result is that people can be investigated under these statutes, even if they're not breaking any abortion laws, because of these vague legal definitions and overreach within the system. And we can see this, of course, across all different types of experiences with the law, not just abortion, but you can just imagine, of course, it also applies to cases with abortion. And of course, this kinds of legal overreach disproportionately impacts people of color and undocumented communities. We know that in general, Black, Brown, and Indigenous people are more likely to be reported by healthcare providers, investigated by authorities, and criminalized. These communities already face over-policing, higher surveillance, and systemic bias in healthcare, child welfare, and criminal legal system. We also know that research shows Black women are overrepresented in cases where pregnancy loss is criminalized, even when no law is actually broken. Additionally, fear of immigration enforcement can prevent people from seeking care, especially in hospitals or formal health systems. So if there's going to be a misuse of the law, misunderstanding of the laws, we know that the people that are most impacted by those are people of color. And of course, this is because there is racist stereotypes about neglect, criminality, and these bad motherhood ideas, which fuel suspicion and reporting. Systemic racism and immigration enforcement make these communities more vulnerable to state violence, medical bias, and lack of legal protection. Hospital and social services may involve police or child protective services based on assumptions, but not medically necessary. So they may encounter a social worker who may be very confused about what their reporting laws are, and they might report somebody for taking abortion pills, even though it's completely legal to do so. Then it would kind of force somebody to be integrated into the family policing system, which is terribly hard to get out of. And people in marginalized communities are more likely to lack access to legal support or private care or follow-up services that reduce scrutiny or provide support. So they might not know who to ask for support or help, or even who to go to if they've been accused of something. And a lot of attorneys that they may even be assigned to aren't very familiar with the laws. So these are other ways that we can support people by making sure they have the resources that they need to get the help that they need. We're going to talk a little bit about stigma in a little while, but I just want to mention it here because I wanted to mention how stigma really integrates itself into the system, not just affecting people's experience in getting abortions as patients. It affects healthcare providers, nurses, doctors, midwives, and administrators. So they may face institutional pressure. So that could be from somebody who's in the billing department saying that they don't think that a certain procedure or process should be paid for or should be categorized in a particular way. There could be community backlash, like if your neighbors find out that you are a provider of abortion or you work at a place that does that kind of care. Other professionals may not want to be working with you or recommend you, so there's a form of professional isolation. And then, of course, there's harassments or threats, especially if you're an abortion provider. So there may be people outside your clinic. There may be pro-choice or pro-life people who don't want to work with you or recommend you, and you may receive some very serious threats. And all of these things lead to why people drop abortion services. So again, a lot of people don't want to go into this kind of work because they're afraid of judgment or harm or the kind of pressures that they may face. The legal uncertainty, just not knowing how abortion laws are going to change, can make somebody not want to go into this kind of business or to drop out completely. And we've saw this with a lot of the trap laws that came to be. Clinics that were providing just shut down, in part because of the harassment and the legal challenges, but just not knowing if they're going to be able to operate was a huge struggle. And then finally, of course, burnout. So doing this kind of work is really hard for people across the board, not just providers, but people who are parts of funds, practical support organizations, and counseling. It's really hard to work with people who are really experiencing unnecessary and unneeded pain and suffering. So it causes people to drop out when we really need them in the movement. And of course, so that results in shrinking access. So there are fewer trained providers. And if that happens, then there are fewer appointments. Sometimes entire regions without care are really long wait times. As we saw earlier in the map, many counties in Michigan already have no abortion provider at all. And this trend is actually getting worse, not better. So the Upper Peninsula did have a Planned Parenthood as of 2 months ago, and now it doesn't. So we're starting to see these clinics shut down. So when that happens, people who are seeking care have to travel farther, they have to pay more, navigate more complex systems. And this is all because stigma drives skilled providers out of practice. So this is just a really big note that stigma does not just shape personal beliefs, but it's really embedded in medical systems, education, and institutions. And even when abortion is legal, stigma can make it functionally unavailable when providers are forced out, discouraged, or unsupported. Another big barrier to access is crisis pregnancy centers. Sometimes you'll hear them being called CPCs. Or a fake clinic. So these are predatory organizations that present themselves as medical clinics, but do not provide abortion care or referrals. Their goal is often to dissuade people from having abortions through manipulation, misinformation, and delay. And here's a couple pictures of some crisis pregnancy centers that often they're labeled as Women's Care Center, for example. And maybe you've seen some of these billboards around pregnant and alone. Recently in Metro Detroit, I saw several billboards that were curious about abortion pills, call us. And then it went to a religious crisis pregnancy center. So these often look like real clinics, and they advertise services like pregnancy confirmation or free ultrasounds. They're usually staffed by volunteers, so not licensed medical professionals, and are operated by anti-abortion organizations, often religious or politically affiliated. They're often also set up near a legitimate clinic or school. So you'll actually find them around the clinics that exist. You'll find them, sometimes there's one or two or three within, a mile of a legitimate clinic, or maybe even next door to confuse people. So when they come to their clinic, they're not sure which door to go to. They also really try to set up near colleges and high schools so that people who are young and vulnerable and not understanding what kind of services they're looking for walk into a place that says pregnant, scared, need help. And then they can kind of trap them there and dissuade them. So they don't provide abortions or refer for them. They also can mislead people about how far along they are. So they can do ultrasounds. Sometimes they're not even qualified to read ultrasounds, and they'll tell you that you're, for example, 15 weeks. And so that means you don't qualify for an abortion, even though that's not true. And that can delay care. They'll tell people that abortions can be reversed, which is not true. Claim that abortion is unsafe or will cause cancer, for example, and really use these tactics to scare people. They also collect and store personal information about people without any privacy protections. So these are really terrible, terrible locations, and they're all over the place. So here you can see that on the left side with the black kind of dots, these are crisis pregnancy. These are all the crisis pregnancy centers in Michigan. And then, of course, here on the other side, these are the list of legitimate providers in Michigan. And you can see that CPCs outnumber real clinics by about 4 to 1. And I'm not sure if Tam was able to list a few other. Yes, you did. Great. So there's last week, tonight is a really good source of kind of like a comedic and also devastating review of what crisis pregnancy centers are. There's a few other reviews. And then if you're ever curious about where the crisis pregnancy centers are near you or you see one, you can share it with crisispregnancycentermap.com. So I'm curious in the chat, if you or someone close to you needed an abortion tomorrow, what do you think their biggest obstacle would be? And we'll give it a couple minutes. Feel free to share in the chat. Mm. Yeah, people not even knowing where to begin. I think there's so much social pressure to around the idea of being pregnant that it can be very overwhelming, just the very fact of it. And then not knowing what's real and what's not real, what's legal, what's not real can be really challenging. And then yes, what to choose pills, to choose a clinic. It's a lot of questions. Okay. Yes, for a lot of trans mass folks, really sucks to go to a women's clinic type places. Yeah, of course. If you only know that the places you can go are clinics that have Women's Health Center, for example, on them, that can be terrible feeling. Which is one reason why medication abortion is a really great option through telehealth, so that people can get care kind of on their own terms. We're going to keep this conversation going in this next section here. Yeah, it can feel so lonely just reading from the chat again. So people might not know if they can talk to anybody safely near them that have had an abortion, or there's someone close to them to even ask these questions. So I wanted to provide a few scenarios about what it's like to seek abortion in Michigan. And these are some real life situations. So I'm just gonna, there's 4 of them here. I'm gonna go through them one by one, and we're just gonna briefly share some feedback. So if we have a 17-year-old pregnant person living with her grandparents, and she calls a clinic for care, and they tell her she must obtain parental consent to be seen. And she doesn't feel safe telling them and doesn't know how to reach her parents. What might get in the way of navigating the court system alone? And how long do you think this would take you? I wouldn't even know where to start, to be honest, or finding out where to start or where to get help with dealing with courts would be extremely difficult. Yes. A lot of themes here about just not even knowing what the first step is across a lot of these experiences. How about if there is a 28-year-old mom of two living in Marquette Way in the UP who doesn't have regular periods, so they learn that they are pregnant at 17 weeks, and there's no clinics north of Flint offering in-clinic care after the first trimester. So they have to find someone even further downstate or in another state and get there in time. How would you travel 6+ hours, arrange childcare, and pay out of pocket on short notice? Yeah, extremely difficult. Credit card debt. Yeah. Oh, that's a tough one. Feels like a real trap. A working parent decides to have an abortion but has no paid time off. Missing work could mean losing their job or not making rent. They need 2 days for travel and recovery, but there's no one to cover their shift or help with kids. What would you have to give up to take 2 days off with no backup and no income? I'll say from my perspective as a doula, yes, this is a good contender for an abortion home, totally. Sometimes we've talked to people who challenge or have a challenge so very similar to this, and it ends up pushing them back so far. Weeks and weeks of having to push the appointment back if that's the kind of care that they're seeking, especially if they don't know that they can abortion pills at home. So they're pushed up into a almost an emergency situation where there's no clinic near them that can provide them with care because they just haven't been able to get time off from work. It also requires sometimes people just sacrificing any of their sick time that they may have to be used for this and not actually being able to use it for when they do need to use it. And then what if there's an immigrant with a limited English proficiency? They're searching online for an abortion care, and all of the resources are in English, so they don't have the translated materials, and they're just unsure of what's legal and are afraid that seeking care could put them or their family at risk. Do you think you would feel safe asking questions if you couldn't understand the language or feared being reported? Yes, I'd be scared. If someone didn't know there was abortion pills available or support available in Spanish, which there is, we potentially could have somebody trying to do something very unsafe to end a pregnancy unnecessarily. Uh, and that's absolutely the worst type of scenario. Definitely, I never want to see somebody doing something unsafe when they have options. But if people feel like they're out of options, we know that they will do things unsafe. Also, something that CPCs could take advantage of with people seeking information with language barrier. Yes, absolutely. And we don't know the politics of someone running a CPC, except that they have bad politics around body autonomy. So it really can put people or an entire community at risk. It's a great point. What structural changes would make access real for everyone based on these scenarios that we've talked about? Does anyone have some ideas about what we need more of or we need to create ourselves? Accessible education. Yes, totally. FMLA type paid time off. Yeah, better labor conditions actually feeds into abortion access for sure. Shared community knowledge of this information would help a lot. I mean, obviously, I couldn't agree more, which is partially why we're here. I think one of the most amazing things about the problem about abortion access is that we actually have amazing tools to our disposal to help people. And it's really just people talking to each other and understanding what options are available. And yes, Morgan, Medicaid coverage, at least with state funds, should be a bare minimum, especially for a state that claims to protect and care about abortion access. They have to know that it's not affordable for most people. These are all excellent ideas. Okay, we're going to talk a little bit about stigma, the barrier you can't always see. So, abortion stigma happens when people are judged, shamed, or treated unfairly because of their decisions about abortion, whether they are seeking, providing, or supporting care. And some key parts of stigma are judgment, obviously. So, society viewing something as shameful or wrong, stereotyping. So, people who are unfairly grouped together and judged in the same way, discrimination. So stigma can lead to people being treated unfairly or left out, or self-judgment. So sometimes people start to believe the negative things said about them and feel shame or guilt. And studies show a relationship between abortion stigma and quality in abortion care. So we know that stigma has a very real impact on the way that people experience abortion and think about their abortions. There are four overarching themes that are linked to abortion stigma, and I'm sure everybody here is familiar with them. It's probably the most commonly heard things about abortion, which is that abortion is a sin. It needs to be regulated. It is a result of someone being irresponsible, or that it is private and ought to be kept to oneself, that we shouldn't be talking about our abortions. And that this really has a manifestation between the quality in abortion care. So that means, as we were talking about earlier, there could be limited availability of providers. There may be judgmental or biased behavior from healthcare workers, unequal access based on location or socioeconomic status. So in rural areas and more conservative areas, there may be less likely for someone to set up a clinic. There's poor communication and misinformation, substandard clinical conditions, clinics that are set up to prevent protesters from coming inside, for example. So they might kind of feel like you're walking into a war zone, you know, with their security and bulletproof glass. Or maybe they're just not well funded, so it's very uncomfortable inside. All of these things can cause emotional distress among patients. And as a doula, we see this all the time of people saying, I know this is the right decision for me, but I just feel like I'm doing something bad or wrong. And then burnout and stigma among providers. That's something we talked about earlier as well. So stigma really kind of laying in and making things harder to access. And I wanted to just make sure that can I go back? I don't know if I can go back, but I wish we had enough time to kind of go into more exercises on how to combat stigma and to challenge our own stigma. But I have some links here. Yeah, so a toolkit for understanding stigma and action. And it's something that I think creeps up in ways that are surprising, even for people who are pro-abortion, pro-access. So I encourage you to kind of look into some of these resources and find ways that you can challenge your own stigma so that we can best help others. So we're moving into the final section here, which is what is being done and how you can help. I think this is the most hopeful and exciting part of this presentation, which is that people who are solving problems and ways that you can support and be aware of them. And then we'll make sure that there is some time still for Q&A if there is any questions. We'll make sure that we can answer them. So there are abortion access is made possible by a few core organizational types. So of course, there's abortion clinics. So that's the places where you go and get abortion care, procedural care. If you are curious about where the abortion clinic is near you or how to find one that's safe, ineedanA.com is a great resource. And again, we'll share all these with you. If you're looking for an online abortion provider, either telehealth or online shops, Plan C Pills has vetted all the resources listed on their page. So that is your go-to spot. It's really important we tell people about plancpills.org, the resource, so they know how to get pills. Abortion funds. So abortionfunds.org is a place for a national directory of abortion funds. But I put Hydra Fund on here also because we're not a member of Abortion Funds, the National Network of Abortion Funds. And there are a lot of small funds that are not. So that may not be your only option, but certainly you can start there. And then practical support organizations. And we'll go over to what these types of organizations do. But the one that is regional for our area is called reprotlc.org. But that is not the only thing. So those core organizations make sure that you can get to a clinic if you need it, you can find a clinic, you can find pills, and you can pay for them. So that's kind of the core parts of getting an abortion. But in addition, we know that there's these other type of barriers to access. So there are legal support and information organizations. So one is Repro Legal Helpline. You can call them. They will make sure that if you are a minor, you have access to someone to help you get care. If you have questions about self-managing an abortion, legal questions, you can call them. They can help get you the information you need. Or if you ever encounter somebody in law enforcement that's questioning you, you can call them and they will also help. If you're curious about digital security for abortion seekers, if you're worried that your searches are going to be discovered, or if you're sharing a computer at home and that doesn't feel safe, Digital Defense Fund has a list of resources and tools and tips to stay safe when researching online. It's also a great thing to share with people who live in red states or places where it's banned, how to protect themselves online. ReproCare is an amazing organization that offers peer support for self-managed abortion. So if you have questions throughout the process, you want to talk to somebody, they can help you. And also M&A Hotline, which offers medical advice for those managing their own abortion. So you can talk to a medical professional for free and securely if you have questions about your abortion. And we also have a digital Spanish language oriented companion within the movement, Aya Contigo, and they're excellent and they're a great place to start. But all of these things can be wrapped up in one cool website called You Always Have Options. It's very simple. It puts all of these core resources in one place, and it's the best you can. If you can just share one website with people, I would recommend you share You Always Have Options. I also recommend that you share that information on your social media, put it in your email signatures, tell your grandparents or your nieces and nephews, write it on bathroom walls. It is the go-to place for the most critical organizations. And just so we're aware of what abortion funds do, obviously, probably by the name, you can tell that they help people fund their abortions, but they do a lot more than that. They also help people navigate the logistical barriers. Not all abortion funds do all of these things, but they can always connect you to somebody who can. So besides paying for the procedure or abortion pills, they can help cover travel costs, airfare, gas, bus, or train tickets. There's an organization that flies people on independent flights if they need to go out of state safely. So there's a group of pilots that will fly people. An abortion fund can connect you to the right people. They can also help you book and fund lodging if you have to travel overnight to get a hotel, fund childcare assistance or reimbursement. They can sometimes help with lost wages if you have to take time off from work, and always provide emotional or logistical support, often through volunteer networks. Some funds will also help people schedule appointments, apply for additional support, or connect you with local doulas, clinics, or telehealth options. So if somebody's just really confused about what to do, if they can get their in contact with an abortion fund, they can help them kind of go from there and figure out solutions. Practical support organizations, I know that that term is not always familiar to people, but they help people overcome those additional barriers. So they don't usually pay for the medical procedure themselves, but they are really focused on transportation to and from appointments, lodging, childcare, meal support, accompaniments, so offering in-person or virtual emotional support, or navigating help with scheduling directions and paperwork. And for example, Hydra Fund works with practical support organizations to make sure that all of these things are paid for and covered, because we trust that there are people who are experts in this area can really help when we're all volunteers. So it is really a network of people helping other people. So what can you do and how can you help? The most important thing that I would recommend anybody can do, no matter where you are, where you live, how old you are, your experience, is to know your local landscape. Really get familiar with your regional clinics and the services that they provide. We want to make sure that every single person who we come in contact with is a source of information for other people. And this is a decentralized network of care, and it starts with just knowing how to help others. Make sure that you know the local funds in Michigan. So the 4 funds in Michigan is Hydra Mutual Aid Fund. We are really focused on funding medication abortion through the mail, but we provide doula services and then can connect people with any other services that they need. Reclaim Michigan Wind Fund. That is a fund that serves Northland family planning clinics in Southeast Michigan. So if that is a clinic you plan on going to, that is the place to talk to about funds. Fountain Street Church Choice Fund will also fund clinical care. And then the YWCA Kalamazoo Reproductive Health Fund supports residents of Kalamazoo County. So that is your state's funds, those 4. And then the practical support organization, as I said, is called Repro TLC. And then if you don't know if you should reach out to them, if you reach out to a fund or a clinic, they can kind of confirm the best way to reach them, or you can reach out to them directly. But these are your core organizations within the state. Also, what you're doing right now is part of access expansion. It is part of being a community resource. It is coming to these kinds of webinars, talking with people, learning about what is available and how we can help and what the barriers are so we can combat them. Additionally, if you have the means, please donate to your local funds and clinics, and especially the independent organizations. Organizations that are smaller, that are independent, not like Planned Parenthood, often serve the majority of people, but are also often left out of fundraising efforts. So when you see like celebrities or major companies donating money, know that they're often not reaching the majority of people, and we're all still struggling out here to help people. So if that's within your means, please do that. And if not, offer to volunteer your time or skills. Reach out to your local clinic or your fund and ask them how they can help. We definitely do not recommend that you use like the hotline numbers for patients, just so we don't clog it up, but just try email or maybe reaching out to somebody that you know has worked there and ask them how you can help. Share accurate information, so help people find legitimate clinics, tell people what crisis pregnancy centers are. Talking about abortion really helps expand access. Using Yelp and Google to write 1-star reviews of crisis pregnancy centers is incredibly helpful. Most people use the internet to look for their nearest abortion center or nearest pregnancy center, and they have really gamed the Google search. So crisis pregnancy centers show up first. So if you just start to rate them poorly and write, this is a fake clinic, they won't help you. People will start to see those and they'll skip them. So it is like a super easy thing that anyone can do for the most part. And I encourage you to do it. You can also distribute sexual wellness information in your community. Hydra Fund has a system where we are distributing information about abortion and other types of materials around sex and reproductive health care. If you'd like to get involved in distributing them in your neighborhood or anywhere near you, just email us and we will give you more information. And then host and bring people in to share information. So don't just wait for opportunities, really be proactive about it. Host a teach-in. You can ask Hydra Fund to come and teach a group of your friends how to use abortion pills, or we can do a training similar to this. You have a book club or training with friends, students, or coworkers. And if you need any recommendations, we'd be happy to give you a list of things that you can talk about or books you can read. Also, don't forget about the people in your life, of course. Offer to drive them, go with them, or listen without judgment. If there's someone who needs an abortion, tell them in advance that if they ever did need that, they can come to you. Really learn how to be a support person for someone having an abortion. If you're interested in being trained in an abortion doula or hotline volunteer, you can always reach out to us and we can connect you with those opportunities. But it really goes into a lot more detail on how to help people who are seeking abortions. And then finally, advocating for policy change is not something that is to be dismissed. We do need to end Medicaid bans and parental consent laws. We should contact lawmakers to support or expand telehealth, or even just push to make sure that college campuses, for example, tell people that telehealth is an option for them. And we could fight for real public funding for abortion and reproductive care. So one of our last prompts here is, what way can you show up for abortion access this month? Yeah, tell someone about you always have options.com. Yes, I wore my aid in a bet shirt to Pride and told people who asked about it about the local fund. It's fantastic. I love how simple these are and how impactful they can be. Maybe for those of that aren't responding in the chat or don't want to, just think about somebody you can tell one of these, tell something that you've learned today to, just somebody in your life, a partner, a friend. Um, hey, today I learned about crisis pregnancy centers, or did you know that you can get abortion pills online for free? Another thing that I failed to put in this chat or in this slide, but I wanted to make sure that you all know, is that you can still go online and also get abortion pills without being pregnant in advance. And that is something that you can do. Abortion pills will last for 2 years, typically, before they start to become a little less effective in their expiration date. But you can go onto Plan C and look for places where they and look for providers that are willing to provide what they call advanced provision, and just get one set of pills to have on hand. And if $150 is too expensive for you personally, get together with a group of friends and go in on just one set of pills, because the likelihood that you might need one in the next year might be slim, but maybe you and four other people have a higher chance of one of you needing it. And then you have a little collective of people who are sharing access to abortion pills by being prepared. Then you don't have to deal with the wait times. You don't have to deal with the shipping times in a crisis situation or under stress. You'll just have them on hand to take when you need them. Maybe tell someone that in your life. Okay, here's our just final reflections. Access takes more than laws. And I think this is critical because so much attention, publicity is around lawmakers and people with a lot of power and resources changing the legal realities. But it doesn't end there. And even in a state where abortion is legal, it doesn't mean it's available, affordable, or stigma-free. And legal rights mean nothing without practical access. And access doesn't come from institutions. It really comes from us. It comes from us pushing for those laws. It comes from us making sure people can get there, and for pushing for reforms and changes. And one of the most important things to really take away is that you are part of this infrastructure and you are what makes abortion possible. It's not just that we are here to support the system. We are literally the system of care. Those funds that we were talking about, the clinics, the practical support organizations, so many of those are run by people who care deeply about this work and are doing it and either underpaid or as volunteers. And they're doing it because it's extremely important. Of course, that doesn't mean that we shouldn't have these fair labor practices or high wages. but I'm saying that those systemic inequities still exist and people are showing up because they care that people get abortion access. And I'm just so wildly happy that you joined us here. And I really hope that you leave knowing that this movement doesn't belong to someone else. It really belongs to all of us, and that we're really building it together every single day together. And that's how we get, that's how we improve access. We need all of us. So we have a few minutes left for Q&A if there is any questions, but anything that we talked about, we'll leave it open for a couple of minutes. And also, if there are no more questions, or I just want to make sure that before people drop off, there's a survey. Thank you, Tam, for adding the survey. It's really quick. It's all questions are optional, but if you have some feedback about how we can improve these types of presentations and webinars, it'd be super helpful. A reminder that you always have options exists. Also, I would encourage people to visit Shout Your Abortion page and how to take action. And then there's a new Shout Your Abortion resource with toolkits that are really accessible resources so that you understand how to get involved in the movement. And these are things that you can print off or share with other people. And I encourage you to do that if you want to get more information about ways to really, really get involved and engaged. Okay, and if there's no questions or if they come up in minds later, feel free to send us an email or message, or you can text me and I will make sure I get the right answer to you. And other than that, I'm just so grateful that you guys joined us tonight.